Hello, it's Sarah here from Triquetra Holistics, and this is part of our series on non-specific lower back pain, which might have been plaguing you for a while now, and you are going to be well shut of it. You'll be very relieved once that has gone. But it is an ongoing process. It requires a slow start. It requires continuity and dedication to make sure that it does work. And then of course you need to progress what you've done so you get to a point where you are strong and things are a bit more balanced and connected, and keep that going with regular classes and sessions. So we have looked at possible causes, our sedentary lifestyles that most of us are in these days, where our jobs are involved in being sat down, whether that's at a desk or driving. Also having children, there's many other things that could contribute, but we're not going to go into too much detail with that. Then we've had a look at breath and how powerful a tool the breath can be when it comes to getting muscles to work and to feel that engagement within your core. So the breath can help you to make the core active, okay, feel it switch on and tighten. It can also help you to do an exercise, so when you need a little bit more power and you need that breath out that's going to give you that burst of power to make that move happen so that your muscles can work harder. It's also a wonderful tool for getting rid of stress and helping us to relax, and that's very important in the healing process. So if there is something that needs to be healed within here, or the hips, as we talked about, then that breath exercise that I gave you last week will work wonders. So hopefully you've been doing that and you've spent all week honing those breathing skills, and now we can put them into practice with some exercises. So as we did last week, we're going to start off really small. So I'm going to get you to come onto your side again, and then over onto your back. So remember about that placement, knees pointing at the ceiling. Feel that you've got the same pressure on each side of your pelvis. Some nice space between your ribs and your hips. Open shoulders, and then remember we said if you're struggling to keep your chin nodded and look more at the ceiling in front of you, if your chin is up here and you're looking either up or slightly backwards, pop a bit of support under your head. A cushion is great. I actually find, you know those gardeners, the padded kneeling pads, as long as it's not too mucky obviously, they're really great. They're just exactly the right thickness for supporting your head. Okay, now I'm going to be moving my arms out of the way for some of these exercises, but I'll tell you when you can just leave them relaxed and down by your side. So let's start off with our breath from last week. Big breath in through the nose, feel it expand all around here, and then breath out through the mouth. Inhale. So we're just making full breaths now. It's not our active breath, it's not our exercising breath. Just big full breaths in and out. Making full use of that diaphragm. Okay, let's make it a little bit more active now. Now I would like you to see if you can use that breath that we practiced, blowing that feather across the table. So let's take a big breath in right into your diaphragm here. Fill the lungs, now blow out, blow that feather across the table. Big breath in. and blowing that breath out. Now I'd like you to continue that, because in a moment we're going to start to add some movement to it. But first of all, on your breath out, just make sure that you're not forcing yourself down into your mat. Your body shouldn't be changing shape consciously. Your skeletal system is staying the same. You can just feel your muscular system contracting as you breathe out. Could you now start to add in a little bit more in the pelvic floor? So gentlemen, if you're watching this, you have the pelvic floor too. It is that diamond of muscles between your pubic bone and your tailbone. So as you breathe out, think of lifting from there and it travelling up the body with that breath out. So the pelvic floor is not a bottom squeeze, although you might feel those muscles will twitch and they might tighten, so might your inner thigh, but it's more feeling it in that area between your tailbone and your pubic bone. Okay, we're going to make a bit of movement happen with this breath now, and I'd like it to be really small, really subtle. So at the minute we're sat with the pelvis level, it should be sat fairly flat, so that if you had a marble sitting halfway between your pubic bone and your tummy button, it would just be sat there. We're going to make a very small movement now and just see if we can roll that marble ever so slightly towards us. Now all I want you to do is just see if you can get the very back of the hips, just the hips, the pelvis, to just kiss the floor and then back again. Okay, breath out. So you can see how tiny that movement is. Barely perceptible, but I can feel it. And what I'm doing with this, so if you keep focusing on that, the more you do it, the easier it'll get, is I'm actually opening the space between my tailbone, which is the very end of your spine, and the first vertebrae. And that's usually an area that is very, very stiff and very rigid, and we haven't moved it very much. So if you're straight away forcing the whole of your spine into the mat and you can feel it all contacting, just bring it back a little bit more gentle, bit smaller, much more subtle. Again, if you're squeezing your bottom to do it or clenching your thighs, you may be going a little bit, you're trying a little bit too hard. Just nice and gentle. Breath out and in. Okay, now we're going to come up to this end where the bottom of the ribs are and your diaphragm and your rib cage, and we're going to be moving that rib cage as though it's a little rowing boat rocking on some gentle waves. So as you breathe in, I'd like you to draw your shoulders down and just see if you can lift your sternum towards the ceiling. And then as you breathe out, can you bring it back down and tuck your ribs down? Really pull the front of your rib cage towards the floor. Inhale, you're going to draw the shoulders back, lift your breastbone. Exhale. Bring it down, really tuck it down. Now keep that movement happening. Breath in, you're coming up. Breath out, you're tucking down. But again, I'm not forcing the whole of my spine into the mat. So make it as small and as subtle as you need to start loosening everything up. Yeah? And then the more we nourish this area, the more hydrated it becomes and the freer it will start to move. But it will take time. It will take practice. It won't happen in one session. You need to stick with this. So let's take a breath in, lift, and a breath out. Bring it down. Let's do 2 more breaths. Inhale and exhale. 1 more. Okay, now I'm going to bring, excuse me, feet and knees together. Now, if knees together is not appropriate for you, or it causes any aggravation, you could maybe squeeze a pillow between your knees and just see if that helps. If not, just leave this exercise for now. So what we're going to do now is put the hands on the ribs. So again, make sure you've got your little finger on your bottom rib, not your thumb, so you've got your hands on your tummy. You want to be on that rib cage because we want to keep it on the floor now. On your breath out, I would like you to squeeze your feet and your knees and your thighs tight together. So start with a big breath in. Blow that feather and squeeze. Inhale, just let that tension go. Breath out, squeeze together the feet, the knees, the thighs. And inhale, let it go. So give me just a couple more of those. And you're maybe even feeling that tightening, that muscle contraction start to travel into your pelvic floor and your abdominals without you even really having to try very much. If you're not feeling it yet, stick with it. The more you do it, the more you're sending those connections and signals through the body. Yeah, so stay with it even if you're not really feeling it very much. So in a moment we're going to go into hip rolls, but very small hip rolls. I want us to nourish the lower back. Okay, so sometimes when we do a big hip roll and we just take our knees all the way over like that, you're maybe only twisting a few vertebrae, and they're ones that move really easily anyway. Let's work on the ones that don't, because they might be what's causing your problem. So we're going to go small. Keep your ribs on the mat. Let's take the knees over. Breath in. Now breath out, pull them back. Over the other way, breath in. And breath out. Knees go over, breathe in. Breathe out. I'm going to give you a little couple of points to think about while you're doing this exercise. So one, are your feet staying together? So is your top foot coming off the mat straight away and your ankle bones are still touching? Or have you let the feet and knees slide past each other? Just see what happens and how different it feels when you keep your feet and knees in contact. Now, this is just a little head thing, but it really works. Can you think of moving from your centre rather than moving from your knees? They're the bit that you can see. So in our heads, we're moving our knees. I want you to move from here. Think, I'm working, this is where I'm working. And just see if that changes it for you. Don't think about your knees moving, think about rotating from your centre. Now, can you think about just pushing your knees slightly away from you as they go over? Send them diagonally away. Does that change what you feel? Does it make it a little bit more of a challenge for you? Wonderful. Okay, so from there I'm going to roll onto my side. and use my hands to push me up into a seated position. So that's your second set of exercises, your second little sequence to have a go at for this week. So this is building on what you've done last week, which was working beautifully on your breath. So now you can add in a bit of movement and a bit more focus into that breath with our little tucks and curls, muscle engagement, and that lovely side to side movement in the hip rolls. So again, you've not got long to do. Just have a go at this, see if you can find 10-12 minutes every day just to have a go at this little sequence, and then next week we'll be able to progress on some more exercises.